So then tell us a little bit about the healthcare proposals that are on the table. It's such a confusing mass.
Yeah, yeah. What's interesting is if you actually look at the proposals side by side, and I would recommend to people, there's the Kaiser Family Foundation has a website, which is kff.org, and if you could Google it, they've got this very neat, and it might be a little policy wonkish, but they have a comparison that shows you side by side, and actually about 80% of the bills, or more I would say, are very, very similar, and they're getting at a lot of basic things, most of which would actually help all of the folks that are the 80% of Americans that are actually in the insurance market. So while we obviously want to cover the uninsured, I think people are not getting what they need for the money that they're paying in premiums. And so it would create a host of insurance reforms. And I don't know if I should step back and if you want to describe the process at all and how we got to these bills in the House and Senate. I don't know if that's helpful. But
go ahead and just explain to us. We are here sitting in early December. We hear a lot of different things about public options, and then it seems as though Nebraska's congressional delegation is not supportive of that. And what does this mean to us? What would a public option mean to us?
Well, so maybe I'll just, the basics, and this is a very basic outline of a more complicated bill, but the public option is only one very small part. We happen to think at Appleseed an important part, but I think it's become such a center of the debate, and it's not actually, it's just really a small part of what they want to do overall.
Okay.
As I mentioned, the insurance reforms, things that there's vast agreement on, that you shouldn't be denied coverage for an illness you had 5 years ago. So prohibiting pre-existing condition denials. And this is when somebody tries to get insurance and either can't because they've been sick in the past and the insurance company doesn't want to take that risk, even if you're paying the premium, or if you get coverage and they say, well, the one thing you actually need to go to the doctor for, we're not going to cover for 12 months. So now that person doesn't, get the coverage for 12 months. So hopefully the bills would initially drastically reduce the amount of time to 3 months that you'd not get coverage for pre-existing condition, and then in, I can't remember if it's 2014 or it's upcoming years, it would be a flat out prohibition, so nobody would face that. It would prohibit rescission, which sometimes insurance companies do, where they say you finally get sick, and then they relook at your application and they say, oh, if you had only told us X, Y, or Z, and oftentimes it's something very small, we never would have given you this insurance policy, so now we're going to pretend like we never did, and now we'll rescind it, and now you don't have coverage. So they won't be allowed to do that. They won't be allowed to make you pay more if you're sick or for another a host of other reasons. So at the moment, insurance companies can charge me, twice, 3 times as much as they charge you, depending on, or your husband or something, because they would make differences based on gender, geography, past health status, and now they'd only be able to look at family size, which I think is reasonable, possibly geography, and there's been some talk about tobacco use, and I don't know that that's going to really happen. And age. They would allow some differentiation between age, and we'd like to see that remain a low ratio. So there'd be those basic insurance reforms. One of the bigger changes would be creating what they've been calling exchanges, which are really organized marketplaces. I almost think of it as a physical place, but I don't know that it would be a physical place per se. But it essentially be a place where insurers would come to offer coverage, but they'd have to abide by some consumer protection. So essentially, if you're going to sell in my market, we're going to make sure that you're giving people value for what they're paying for. And the best thing that I think it would do, and I think it's been pretty successful in Massachusetts for this reason, is it standardizes the information. So if I've got 3 plans from United here and 3 from Blue Cross, I really know how those are comparing for my needs and my family's needs, and I can pick the one that's of the best value for me. Where the public health insurance plan would come in is it would be one of the options that you could choose from in the exchange. So theoretically, you'd have, I don't even know how many private insurance plans offered, and then you'd have a plan offered by the public health insurance plan, which in most instances is going to be run by, I think the suggestion is it be run either by it certainly would be nonprofit, it might be run by a nonprofit. It'd have to abide by the same rules as the private insurance industry, live off its own premiums, all of that stuff. So just be one choice. I think the benefits to it, if I'm not going on too long.
No, just one moment.
Yeah.